Hi everyone, and welcome to Nairita's Talk, dedicated platform to help you all find the right insights and the right information in the beauty and aesthetic world. Bringing education, sharing the latest technology, and introducing you to the best doctors. Today, we're very fortunate to have Dr. Al-Ali with us to share his fruitful insight in this field. Hi, Doctor.
Hello, how are you?
Good, and you?
Good, good.
So tell us more about yourself.
Well, I was trained in Georgetown. That's where I went to medical school in DC. And then I did a residency in plastic surgery. And eventually I ended up at the University of Iowa where I was faculty. It's a place where bariatric surgery, which is the surgery where people lose weight from, was started. And since these patients, when they lost a lot of their weight, they needed help. I was there at the University of Iowa, and since this was a very unusual type of patient, we had to develop new operations to treat them. So through my association with the University of Iowa, we kind of pioneered that branch of plastic surgery, which today is very popular. Back then it was not. So that's kind of what my origins as far as why I'm here. The local hospital over here that brought me over, obviously there's a lot of obesity here and a lot of people with weight loss. So they brought me over to help take care of those folks.
And we know that you have in your records 2 books. Can you tell us more about these books?
Well, the first book goes along with what we talked about, is that plastic surgeons really didn't know how to do this kind of surgery because they weren't exposed to those patients. So what we did is we developed these procedures and then put them in a book. And that way plastic surgeons, from around the world could learn how to do these procedures. And it's kind of considered the Bible of this kind of surgery, fortunately all over the world. And then over the years, now it's been since 2006 that book came out. Myself and one of my friends from Brazil, and these 2 countries, the US and Brazil, are kind of the real strong countries in body contouring, decided to expand the body contouring book, which was originally concentrated on massive weight loss patients, now the entire range of body contouring. So 1 volume is dedicated to just general body contouring, and we collected some of the best plastic surgeons in the world to teach us how to do that. And then the original massive weight loss body contouring surgery volume is the one that I'm in charge of, and we're putting that out fairly soon.
So today we'll be covering about 2 topics. One is the common mistakes in the buttock surgery, and the second one is the art of the body contouring after
massive weight loss.
Right. Can you tell us more about these common mistakes that are happening nowadays?
Well, I think one of the major problems with people wanting to augment their buttocks is that people are going to practitioners who use permanent fillers. And sometimes they're not even practitioners, sometimes they're just lay people who get products that are completely inappropriate to use, and they inject it into people's buttocks.
Can you specify more, like, what do you mean with this? Is it like, can we talk about the material? What is it all about?
The most common material that's injected in the buttocks that is of permanent nature is silicone. Silicone in a breast implant is contained within the implant, and it's fairly well controlled. If you have a problem with it, you can eliminate it. But when you inject silicone, free-flowing liquid silicone, into an area of the buttocks, it's like injecting water into a sponge. You can't get rid of it if you have a problem with it.
You cannot control the...
You cannot control it. And in order for you to get rid of it, you'd actually have to eliminate the entire buttocks, which is horrendous. So the problem with that is that if people have trouble with that, and they most often do, infections, hardening, pain, it's a lifelong problem you cannot eliminate. So unfortunately, that's what's going on out there quite often. There's a huge push, probably because of the Kardashians, of people wanting bigger butts. Well, yes, you could do that with fat, and as long as it's done well by legitimate practitioners who really know the limits, it's something that can be done. but when it's done by lay people or people who don't really care about their patients, it can be very dangerous, especially if you use a permanent material like silicone.
But if the patient, they don't have enough fat to inject in their buttock, is there any other kind of procedure they can have?
Well, you can have buttocks implants, which are similar to breast implants. Again, they're contained structures. They're not all made of silicone. Yeah, it's an implant. Everything we do in plastic surgery has a good side and a bad side. So it's safe for the right patient, done by the right doctor. It can be dangerous, it can be bad, but that's everything that you come across in any kind of aesthetic arena.
But when you say like a right doctor, I know that I hear a lot of like frustration or kind of confusion with people when they say, I need to find the right doctor. What's your advice on this?
So in the US, where I come from, there's an easier way to determine that, especially in the area of the buttocks. Generally, you're going to talk about board-certified plastic surgeons. But that's limited to America. Here in the Middle East or in UAE, there's a variety of doctors from all over the world, and they may not be board certified in the same sense that American doctors are, but they can be very good doctors. So you can't use that terminology. But what you want to do is you want to make sure that first your doctor is a plastic surgeon, because there's a variety of people who are not plastic surgeons doing plastic surgery. So that's the first thing. Number two, are they trained in a legitimate place, meaning do they come from a good university? If they have board certification in that country, are they board certified? In Europe, there's a European board, so you can get that, or look for that. I think word of mouth is good up to a point, but unfortunately, the lay public really doesn't know the difference.
What is right and what is...
The difference between a good doctor and a bad doctor, and a lot of people just think if you have the word doctor before your name, it makes you legitimate. It doesn't.
And the marketing and advertising nowadays is like, it's not very accurate for people to just go and find the right doctors.
Well, absolutely. I mean, marketing and advertising has nothing to do with truth. There's nobody that controls that. There's no government entity that controls that. So, if somebody claims anything on the internet, they can claim it. There's nobody to check them. So it really is left up to the patient and the consumer to go find out, the details about the doctor that they're utilizing.
If you face any complication in the procedure or post-procedure with your patients, how do you handle that, doctor?
Well, I think to be fair and to be accurate, any surgeon who tells you they don't have complications is pretty much a liar, or they don't operate, okay? So every procedure that you do, there's a certain percentage of things not going quite as planned. Now, how do you handle complications versus how you handle them badly? I think part of the reason you want somebody who's well trained is they are trained to handle complications. First of all, you have to recognize them and how to treat them and do everything that goes along with that. It would be too general an answer to say how do you handle complications, because it depends on what the complication is. But in general, what you want to do is you want to make sure that you are trained well enough, or your doctor is trained well enough to recognize that there's something going wrong and what to do about that once they discover it. We could talk about very particular procedures and talk about what those complications might be, but in general, that's what you want, is you want a doctor who's well trained and trained to handle complications, because that's really one of the main things that differentiates good doctors from bad doctors.
And can you tell us the difference between a normal plastic surgeon or reconstructive plastic surgeon? What's the difference between these two?
So the specialty of plastic surgery, the more accurate description of it is plastic and reconstructive surgery. So plastic surgeons, when they're training, they train to do both reconstructive and cosmetic procedures. Everybody's trained like that. You wouldn't be able to become a plastic surgeon unless you were trained to do everything. In the end, some practitioners choose to do reconstructive only, and some practitioners choose to do cosmetic or both. Now, what's the difference between cosmetic and reconstructive? A reconstructive procedure is a procedure that takes something that's been either naturally abnormal or has become abnormal due to trauma, cancer, or whatever, and the doctor is taking it from abnormal, trying to put it back into normal. A cosmetic procedure is you take somebody who already looks normal, they just want to look better, whatever part of their body. Let's say they want a better looking nose, or they want a better looking breast, or a larger breast, whatever. So the structure is already normal, you just make it better. That's the definition of cosmetic and reconstructive. But most people trained as good plastic surgeons, trained in both originally, and then they tend to specialize.
Let's talk about this, the body contouring. What's the latest trends in body contouring?
Well, in today's world, there's a lot of fat injections into the buttocks. That's kind of the big thing. I will say, and it's important for the public to know, that of all the procedures that we do that are cosmetic in plastic surgery, this is the most dangerous procedure because there's an actual death rate associated with the procedure. So the number is as high as 1 out of 3,000 people will experience a death with fat injections of the buttocks.
Can we know why, just briefly?
Sure. So it's difficult because plastic surgery has not figured out the exact reasoning for it. The theory that's most probable is that as fat is being injected, it gets in some of the veins in the area of the buttocks, which are large veins, and they will go up into the lungs and basically cause a death. But at
so
this
basically the fat moves inside your body?
Only if it gets into those veins, yeah. When you put it in, you're supposed to put it in right there, it's not supposed to move. But that's what's happening in this particular area. Because fat injections anywhere else in the body, it doesn't happen. It's just in the buttocks. So what's happening is the world of organized plastic surgery, especially in the US, is spending a lot of time trying to figure out the reason for that. So some surgeons are comfortable enough doing it right now with some precautions. I myself have stopped doing fat injections of the buttocks till this is completely figured out. But that's a trend that will come and go because it's based on certain, popular personalities.
Does it apply on the fillers as well, the hyaluronic acid, or it's just the fat?
No, it has not happened with
hyaluronic acids.
With hyaluronic acids, mostly because you can't really inject deep enough with those or put enough into the buttocks with that to affect things. Because when we're talking about injecting fat into the buttocks, you're starting at around 100 to some people put in a couple of thousand cc's. If you put in 100 cc's of a filler, the cost is so prohibitive the average person cannot afford it, and it wouldn't be a good idea in the first place. So fillers are not really part of the problem at this point. Now, as we said, permanent fillers are a different problem than what we're talking about here. In answer to your question as far as trends in body contouring, I think if you look at the trends over the last decade or decade and a half, it is in the world of body contouring after massive weight loss, because these patients in numbers are the greatest numbers. In the US, there's up to 160 to 180,000 people have bariatric surgery a year. So those people lose weight, and then they have all this hanging skin, and then they need to take care of it. So in the Middle East, obesity is a huge problem as well. It's actually the only place in the world, and especially the GCC, the only place in the world that has the same rate of obesity or higher than America. So there's all these people that are getting bariatric surgery, they're all losing the weight. In my clinic, I see up to 8 or 10 patients a week that are massive weight loss. It's probably the most common thing that walks in the door outside of noses for my particular practice. But what's really important to understand for people is that the ordinary procedures that most plastic surgeons are comfortable doing do not work very well for massive weight loss patients. So let me give you an example. So a lot of young ladies, after having a couple of babies, their bellies are not perfect, so they come in for tummy tucks or liposuction.
Mommy's makeover.
Yeah, mommy makeover. But it's limited to the front. The problem with massive weight loss is when people are heavy, they're heavy all the way around. So when they lose the weight, everything is dropped. So not just the front, the sides, the back. So what's mostly done for them is a circumferential procedure where we go all the way around, and that's a bigger procedure. So surgeons who are not regularly trained to do that kind of surgery are just not in tune to it. Same thing in the arms. We had to invent a particular operation for the arms that works for these patients because they have huge arms. And if you do a regular procedure that most plastic surgeons do, it will not fix the problem at hand. So,
how long is the procedure?
well, it depends which one
Like
we're
the
talking
full
about.
all over the...
So for me, I break it up into 3 parts. So this procedure that goes all around the lower aspect of the trunk usually is somewhere between 4 to 6 hours to do. Then the upper body, which is an upper body lift, this one I call a belt lipectomy, an upper body lift which involves the arms, the upper back, and the breast or the chest, depending on male or female. That's another 5 to 6 hours. And then the thighs usually I do last by themselves. And that's usually about 3 or 4 hours.
But we're not talking in the same day, right? So you divide.
For me, I would never do them in the same day. You have to look at the safety profile. So the longer a person is under anesthesia, the riskier it is for you. So for me, I don't ever plan longer than 6 hours of operating because I could put the patient at risk. Now, this is elective surgery, so I should never put the patient at undue risk. So I limit the amount that I do in any particular procedure.
So finally, doctor, I know that every plastic surgeon, they have their own signature procedure or their favorite makeover. Which one is yours?
So I'm probably a little, I have a little bit more than one because a number of these procedures, as I mentioned earlier, we basically either invented or developed. So the one that I'm most known for is a belt lipectomy, which is going all the way around. There's an arm procedure that's associated with our particular technique, which I believe right now is the most popularly used in the world. And then the entire upper body lift, we actually named that procedure and we have kind of developed it. So those are the 3 signature procedures for me. It's interesting because when I came over here, my original origins, I was very interested in rhinoplasty, and when I came over here, those patients come to me quite a bit too, and I do a very large number of rhinoplasties as well. And rhinoplasty here in the GCC is very different than anywhere else in the world. It's just a complete set of circumstances that are different. So that's the other thing that I do a lot of.
Very good. Thank you so much, Doctor.
My pleasure.
Thank you so much for accepting our invitation. And hopefully we'll visit you on your clinic very
Absolutely.
soon.
Thank you very much.
you.
Appreciate it.